So to be honest, I feel like I'm partly guilty and responsible for the popularity of Morpheus8 because, as most of you know, Kim Kardashian admitted to using it, and she had that done in my clinic.
Okay guys, I am back for my second stomach treatment with the man, the Morpheus.
We had a lot of people seeking the treatment, wondering what it can actually do, and explaining the science to my patients is my favorite part. To really explain and delineate out the biological effect it has on tissue, and then also how it can work synergistic with other treatments that we do. So it's a very versatile technology. When patients come and ask for it after they've seen Kim's video or they go ask their own doctors about it, they end up being very satisfied with the results if the treatment's done well and curated for their skin type and their condition. And that's the beauty of it. With all the different versatilities, the setting modes, and how you overlap the treatment zones and everything synergistically with other modalities, you can really optimize all the skincare management of the patient. I think really the holy grail of a lot of aging and basically our outer appearance is our skin. And the holy grail of that is skin tightening. We all lose laxity, we deflate in our fat compartments, both in the superficial, intermediate, and deep layer from head to toe. So when we can go and deliver energy at the right depth and tighten that tissue layer of skin and dermis, and sometimes even when we want to get some of the fatty layer disintegrated and get it to be lower and less density, it's a win-win for the patients. The key is to know in what patient what to do, how many treatments, how far apart. To me, when patients talk about Morpheus8 melting some of the fat under the skin, I think in certain areas that's desirable. And when you don't want to do that, you just change the depth level, the energy level, and how often you deliver it and to what patient. If somebody who's 70 has deflated skin already, obviously we're not going to go to 5 millimeters or 4 millimeters. So really it's customizable. But all of this comes down to and boils down to skin tightening from head to toe. Everybody wants that, and that's one of the first signs of aging that we see is loss of laxity and elasticity in our tissue. So Morpheus8 I use on very superficial areas that have very crepey kind of skin, the collagen that needs to retract. And one of the things I tell patients, the analogy I use, imagine kind of like a skateboarder's loose, Vans shoelaces that are not even tied. Compare that to a figure skater's OCD, really tight shoelaces. That collagen is like that. What Morpheus does through heat delivery organizes and gets the collagen to remodel so it's tight, like really interlace the lattice of shoelaces. And in that sense, basically, depends on what part of the body or face we're treating. If someone has really thin skin on their body and they have more striae, stretch marks as they're called, or they have texture issues or a scar, we'll use Morpheus8. But if I actually want deep tightening of someone who's almost ready for a tummy tuck or mini tummy tuck of the abdomen, or especially the upper abdomen, and even in areas such as supraumbilically above the umbilicus or belly button, where a lot of people have piercings and atrophies, that area, tightening with Morpheus8 as well as Morpheus body gets all the layers, and then we go and fill with either some fat grafting or other filler device to get that area filled as well as tightened. So the combination of filling and tightening is really the synergy that we like to use here, both in the OR and in our clinic. Depending on the goal in each patient, we'll use Morpheus body, or we'll use Morpheus8 if it's more of a superficial, and certainly obviously on the face, we're not going to use Morpheus body. So I've been in practice for almost 20 years, and I've had a lot of devices come my way. I've had a lot of devices I've utilized for different purposes. The advantage and the next level treatment that Morpheus8 can provide is mainly the power and robustness. The technology and the needle size, the needle amount, and the various depths that we can go is more varied and customizable than other devices. In addition, the body mode is something that no one else really has. To be able to go that deep and go at multiple depths, interspersed and intermittent, is a perfect way to treat people who are not quite ready for actual excisional tightening. One of the advantage, obviously, of having all these devices is when you have a device like Morpheus8 that actually works and you do it properly for each patient, that patient's going to go tell their friends and family. So that kind of spreading of that word of efficacy that it provides keeps the practice running, keeps the patients happy, and they come back for more if the comfort level is set right, the treatment zones, energy, and depth is delivered right. And that's really the artistry of this, and that's why it's so important to be educated on how to use it properly and take the most advantage out of it while patients are both comfortable and get results that they want and desire.